Dear audience, dear fellow entrepreneurs, welcome to our very first live stream where we say hi to you from a live virtual studio of Startup Grind from London. We would like to welcome you here, and I want to tell you very briefly what is to be expected. We don't have just one speaker as we usually have. We have 7 speakers today for you. And we'll be hearing from some insightful entrepreneurs. And after these talks, we will then have a live virtual networking where we can join us as well. So before I bring you our CEO, I would like to say thanks to our partners and companies who helped us make this happen, especially Google for Startups, Silicon Valley Bank, and our local partners, which are helping us every single month, Hardsoft and WeWork Labs and Louis Silkin. And now, without any further ado, I would like to bring the man whose mission is to help educate every entrepreneur on the planet. And this is why he started Startup Grind over 10 years ago. So please welcome on our stage, Derek Anderson, the founder and CEO of Startup Grind.
Thank you so much, Marian, and to the entire community there in London and across the world. Greetings from Palo Alto, California. I'm grateful for the opportunity today to listen to Anne speak about 23andMe. She is one of the great entrepreneurs of our generation. And for 5 years, we at Startup Grind have dedicated a special month each year to feature incredible female leaders on our stages across the world, to promote these women that lead and run incredible businesses. For this year in June, we will have 250 women speaking in more than 200 cities about the companies that they have built and run. And there is no one that has been more successful, but also maintained humility and grace the way that I have observed Anne has over the years, and we are so thankful to have her here. I would like to speak briefly about the recent protests for racial injustice that we've seen across the United States and the world. As I'm sure many of you, I have been saddened and dismayed to see the treatment of our brothers and sisters of color, both at the hands of the justice system, as well as the economic and cultural systems which exist across the world. I have watched, listened, and mostly looked inside myself about what I could have, should have, and will do moving forward to be a more meaningful part of the solution the world needs to eradicate racism. Racism, in my experience, is not just an American problem, it's a human disease. I have lived in 3 US states, and I have seen racism in each of these places against people of color, Latinx, and other minority groups. I have spent 6 years living in Europe. As a child in France, I saw firsthand racism against North Africans I went to school with who had migrated to Europe. As a teenager in Germany, I saw the racism of the past, visiting the Dachau concentration camp, and I saw racism in the current day against Turkish immigrants who lived in our small town. While living in New Zealand in my early 20s, I saw many instances of racism and bias against indigenous Maori and Polynesian populations. It's on each of us to stomp out racism inside and around us. A few weeks ago, I sat down with my 11, 8, and 5-year-olds and watched the difficult videos of George Floyd's murder from May 25th and Eric Gardner's killing by the New York City police a few years ago. We watched the videos of young Black children, their same age, talking about how racism had hurt them and scared them and impacted their lives negatively. I was amazed at my own children's pure reaction and disbelief to how anyone, especially someone in a position of power, could treat another human being in the way the police treated these Black men. I do not think my children's reaction is anything unique. I think it's, this disease is something that is learned. It's something that's gathered over time on our earth journeys, and children see the world in many ways the way I wish that I saw the world. I am thankful to my own parents who taught me to love my neighbor as myself. They made it very clear at an early age that racism was wrong, that it would not be something tolerated in their home, nor would it be something we should accept from people around us. That said, I can personally do much better. Our life's journeys are a race against ourselves. And I am personally working every day to be the best CEO and human being that I can be. Some days and weeks and months I fall short of what I know I can be, and other times I keep pace with my best self. When I think about fixing all of the world's problems, I get very discouraged. But when I think about impacting my own sphere of influence, I feel energized that I can make a great difference with my kids, with my family, with my friends, and within my company. The phrase that keeps playing in my head again and again through this entire ordeal is a simple but beautiful line: to be the change that I wish to see in the world. As the weeks and days stretch on, personally, I already feel behind. There's so much I can do. We don't need to change anything. We just need to change the pieces that we can control. Whatever your sphere is, big or small, it doesn't matter. If we just each do the best we can do, then we can overcome this together. With that, I'm grateful again to everyone is a part of this event, and I would love to pass the time over to Gary Stewart, founder of The Nest and longtime friend of Startup Grind, to speak.
Well, first of all, I want to say thank you to Derek and to Marion for letting me join you all today to be part of the Startup Grind's Women's Month event, and also to Derek, especially for his heartfelt message of support for the need to eradicate racism. I think you guys are doing amazing work, and it's great to count you guys as allies. In the spirit of the event, I kind of wanted to start with a quote from a woman whose situation I read about in, I think, yesterday's New York Times, for suing Morgan Stanley, her former boss, for racial discrimination. She had been there with Morgan Stanley for about 26 years, with 16 of them being as the head of the global head of diversity. Her name is Marilyn Booker. What's interesting to me is that she sued the bank because she didn't believe that they were doing enough to support Black employees. Her budget was apparently cut by 71%, and she felt that she was always trotted out as the token minority, even once testifying to Congress on behalf of Morgan Stanley. And the quote that she said that really resonated and stuck with me was, quote, "My story is the same as those of many Black people on Wall Street. Our fate has been tied to the goodness of whatever white person is in charge. That is no way to have a career." And what's even crazier to me than her story is the fact that the numbers that she's been complaining of, that is the 2.2% of Morgan Stanley senior leaders that are Black, despite the fact that Blacks, at least in the US, are 13% of the population, these numbers are way better than what any Black founder can expect in the tech industry. So even though we're saying that we're way ahead of kind of other industries, the reality is that only 1% of VC-backed founders are Black, only 1% of the decision makers at VC firms are Black as well, and that this translates into about 7 Black people, 7, with any decision-making power at the top 102 largest VC firms in the US. And even though we don't have the numbers in Europe, because in Europe they don't tend to count or to get the numbers, I'm expecting that the numbers would be at least as bad. So taking into account that we're here to celebrate women, I kind of want to look as well as the stats regarding women of color, at least in the US, again, because that's where we tend to have more statistics, since that we don't tend to tabulate them in Europe. Of all VC funding over the past decade in the US, Latinx women or Latinx women-led startups received only 0.32% of all VC funding, while Black women raised 0.0006%. So that's why I think that it's really time for us to stop talking and time for us to start acting. As Marion said, and it's Derek as well, I think, I used to run an accelerator in the UK called Wayra, where we invested in 185 companies over the last 5 years during my tenure. I left that in December because I really felt that it was time for us, even as Black people and people of color, to kind of stop accepting the status quo and to think about how we can actually make a difference. And I teamed up with a woman named Rasha Khawaja Saeed to kind of found The Nest, which is essentially like Masterclass, but it's focused on founders. And we want to make sure that we're telling the story of all founders, of all races, genders, ethnicities, socioeconomic status, etc. We're currently in private beta, so if you'd like to kind of get more information, please just add me on LinkedIn and I'll send you an invite. But more important than kind of what I'm doing individually, I think that we have to ask ourselves what we as a community can do. And that's kind of the point of an article I wrote last week in Forbes, where I said that, it's time for the tech community to stop asking Black founders to be happy being at the back of the bus and to not complain about it, to never ask any questions. And this is why, again, while I support really wonderful events like the one that we're at today, like Rosa Parks, I think that Black people are sick and tired of being ignored and treated with a presumption of inferiority. That is the only reason that we can justify the abysmal numbers that we're seeing in terms of the investment rates for Black women, Latina women, and people of color more generally. This notion that there is a pipeline myth is frankly insulting. The idea that I have as good an education, as good as a background as anyone else, but I know that when I go into a room, I'm going to be viewed differently. That's what needs to stop. There is no pipeline myth. There's simply a fact that a lot of people just don't estimate Black people, whether consciously or unconsciously, as equal. And that's the reason that this then kind of translates into the abysmal numbers that we're seeing in terms of venture-backed funding or support more generally for Black founders. And the reason why I brought up the Morgan Stanley example is because I don't think it's an issue that's unique to tech. It exists in every single industry in the US and across the world. What is particularly interesting about tech, however, is that even though we are supposed to be the frontier of the future, the numbers in tech are by far the worst, or at least a lot worse than any big bank that you would see in the US. So I think that it's now time to kind of focus on concrete things that we can do to kind of change the situation. I propose 3 things in particular. As we see from the statistics, women of color are the real unicorns in this industry. Let's apply some of the same targets and public shaming to focus on them. Let's also focus more on metrics. Funders know how much metrics work. Let's make sure we know the metrics in the UK and in Europe and all around the world. And let's also put our money where our mouth is. It's easy to talk. It's much more difficult to act. Let's make sure that this time next year when we meet again, the numbers are definitely beginning to go up for minority founders and Black founders in particular. So with that in mind, I now want to kind of switch over to 3 women who I know are real allies and are really concerned about diversity for all people: Marta Krupinska, Charlotte Guzzo, and Shardi Nahavandi. I know that Marta in particular has been an amazing ally to the Black community, so now I'd like to pass it over to her.
Wonderful. Thank you so much for having us at this fantastic event. Gary, thank you so much for all your incredible, inspiring, cutting words. And I will say I'm humbled and touched by, if I could hear from you that you think there is work that I do and we do that is true allyship, then that's one of the best compliments that I could ever expect to hear. Startup Grind, thank you so much for putting this together. It's such an important time that we come together, that we talk about these issues, that we give examples of good work and support, and that we shine a light on this very, very important issue and how we can really level the playing field for founders, regardless of what they look like, where they're from. And I am really, really pleased to be joined by incredible women that will be helping me tell that story. But briefly, about me and about what I do and what we do at Google for Startups UK. I have actually been a founder myself, and very, very often the only woman in the room, almost exclusively surrounded by exclusively white people, which sort of led me to Google a year and a half ago. And since then, I've had the great privilege of leading Google for Startups in the UK. And what we do is really focused on supporting, amongst others, underrepresented founders. And we really try and use the platform that we have as Google and at Google for Startups to advocate for all of the important things that Gary's mentioned. And I'm happy, related to his point on, actually walking the walk, not just talking the talk. We have been doing important work to support underrepresented founders. And I'm so pleased to be joined by two alumni of two consecutive women founder programs, Shardi from Pexxi and Charlotte from Sano. And as we go into the discussion about women founders and women founded businesses and the path that we're all on, I am also very, very pleased to announce, I think that might be the first time, and a sort of snap preview of what's coming following our long collaboration and support for the PocTech community, including our relationship with such organizations as Scholar in Tech or 10x10 VC. In September, we'll be launching a program for Black founders. So if you know great Black founded startups, please let us know, because we would want to bring them in and help them achieve all the greatness that they absolutely deserve to achieve. But now, we said Anne Wojcicki, obviously incredible entrepreneur. We all have heard of the story of the great health tech startup that she's built, but I'd like you to meet two women that I believe will soon be at least as well known as Anne, because what they're building is really, really cutting edge and important. So Charlotte, over to you. Tell us about yourself and your business.
Great, thanks Marta. I'm super happy to be here today. So I'm Charlotte Guzzo, I'm the COO and one of the founders at Sano, where we're trying to push forward precision medicine by making research patient-centric and data-driven. One of the biggest barriers right now to precision medicine is the inability for researchers to access the right data or to recruit the right patients. And this is largely due to a static and outdated health infrastructure where there are lots of players collecting their own databases, each on their own side, and not necessarily collaborating to bring medicines and treatments that are tailored to the individual faster to the market. So what we're trying to do at Sano is to accelerate the process for recruiting patients so that the right medicines can be given to the right people on a much faster timescale. And we're doing that by building a virtual biobank with a patient-centric interface where individuals can be matched to the right research and can actually enroll clinical trial or even participate online so that we can make precision medicine a reality on a much faster timescale than it's currently going.
Amazing. Thank you, Charlotte. Thank you, Charlotte. Shardi, tell us about Pexxi.
Yes. Hi, everyone. Great to be here. I'm Shardi Nahavandi. I'm the CEO and co-founder of Pexxi. Pexxi is creating a new type of healthcare for women with a focus on whole health. We are taking into account aspects of female health that weren't considered before, such as hormones. And the first product that we're focusing on is tailored contraception, because 80% of women at some point in their lives use contraception. And unfortunately, 1 in 2 women experience horrific side effects, such as depression, blood clots, cancers, and so on and so forth. And this is very much because the sort of women's health is not very well understood. And unfortunately, until 30 years ago, until 1993, women were excluded from clinical trials. And at that time, we were browsing the internet. So there is this huge lack of data within women's sort of healthcare that we are trying to sort of build and bring to the front lines.
Thank you so much. You're both building incredibly important businesses, and you're still very much blazing the trail in the startup world where there still aren't enough women. So can you tell us a little bit about your experience? What's been your experience building your businesses, but also what's the main learning that you found?
I think I'm going to start with that. Yes, absolutely. So I would say, as a female founder and a woman's health, I fall into many different stereotypes. But what I've learned specifically from sort of the Google for Startup community and sort of being privileged to be part of it, it's sort of the allyship and support that you get that you wouldn't otherwise sort of get. And a lot of sort of, let's say, for us, the path forward in some areas that was difficult for us, like fundraising or, you know, getting perhaps deals from B2B partners, was made much easier because of sort of the Google for Startups network. And within sort of the Google for Startups community, this allyship and paying it forward is very apparent. And actually, funny enough, Charlotte was sort of one of my referrals to the program. So this is my way of sort of paying it forward.
Thank you.
Great, thanks.
Shardi, I love the fact that you mentioned allyship. Yes, Charlotte, what about you?
Yes, so that's actually right. I've done the Google residency program on Shardi's recommendation, and that paying it forward is really important in what we do. So just to answer your question on my experience being a female funder, from my perspective, actually having diversity in general in our company and not just being a female funder has been absolutely fundamental in building a company that thrives and that actually moves things forward. I think particularly when it comes to precision medicine, you know, it's in the name. It has to cover such a wide range of individual differences, and it would be sorely mistaken to want to build a company in that field without wanting to bring diversity in. And so to bounce back on my own experience, you know, and related to what Shardi is doing, having a view on female health issues specifically, you know, has brought a dimension to the company that my co-founders couldn't necessarily have thought of. And so likewise, we're also very committed to bringing more diversity in the team that extends beyond just having women, because when it comes to healthcare, we can't have the population represented and serve the best solutions if we don't have the right voices being heard.
That's an awesome point. And also on the diversity point and on collecting data, that sort of what you, Charlotte, said reminds me of another startup that has come through one of our programs, 54Gene, an African startup that is essentially, one would say, 23andMe for the African population, and really making sure that the African genome is also taken into account when trials are conducted. So it's really so incredibly important that that diversity is in all the aspects of how we run our businesses, and especially in health tech. So on the health tech point, you're both building businesses that are very data heavy. That has been Anne's success. And now sort of, you know, following success of the early health techs, you're really looking at the full life cycle of data, starting from research and when the data is collected to how that data is understood and then applied in products for consumers. So tell us more about the work that you're doing. Maybe starting from you, Charlotte.
Yeah, so basically what we're trying to do in a nutshell is to match patients with researchers. It sounds crazy, but actually about 80% of clinical trials are delayed because of the sole inability to find the right patients. And you would think that in today's day and age, with patients often being keen to help and to find a cure, this wouldn't be the case. But this is really largely due to a very bureaucratic system where some pharma companies go through different CRO recruitments that go through clinic, and it's all very outdated. Patients receive 50 pages of documents that they don't understand and don't necessarily want to read. And then when they do participate in research, they don't hear back ever from what has been learned from their data. So the whole process is not very rewarding. And we're trying to change that by putting the patient back in the driving seat and making sure that they own their data and they drive the process. Because what we found is patients who are passionate about the cause are the ones who move the needles. So giving them the tools to actually push research forward is the best way of making research happen faster.
Yeah, so I'm going to answer your question as well, Marta. So for us, going back to the exclusion, of women in clinical trials, it has led to a massive lack of data and understanding in women's bodies and their reactions to medications. Women have 450 cycles during their lifespan. And unfortunately, when it comes to clinical trials, our cycles and hormonal fluctuations reduce statistical power, and that's really the main reason why we were excluded. Fortunately or unfortunately, I experienced this firsthand, which led me to build Pexxi. I was misdiagnosed with bowel cancer because the medical system couldn't figure out that I have a particular hormonal imbalance, and I had to actually go and study 2 degrees related to health to sort of diagnose myself after 15 years, which sort of led us to the thinking of, oh my goodness, no one's looking at female health correctly, and what really the core aim of what Pexxi is trying to build, and sort of our moonshot vision, is to be able to create a dynamic longitudinal data set that looks at women, as in their whole health holistically, and is able to create, a world where drugs are actually created and tested for women. And that's very much the forefront of everything that we do.
All right, awesome. Who am I handing over to? Thank you.
If I could add on what Pexxi, on what Shardi was saying, I still the name of the company. I do think it's absolutely fundamental that we take into account individual variations. So at Sano, we're bringing in genetics as well as a way to identify patients, and going down to the bottom of what it is that makes you unique and that will make you react to a certain drug or develop a specific disease is very important.
Amazing. Shardi, thank you so much for shining the light on the important work that you're doing, and for the inspiration you are for the community, and sort of and paying it forward, as you so beautifully phrased it before. Team Startup Grind, thank you so much for having us. I think it's incredibly important. Thank you for all the brilliant speakers that you've brought in. I'm certainly looking forward to hearing Anne talk about her experiences and her views on building a health tech business and being a woman founder. So thank you so much for having us. And over to you, Marian. Thank you so much.
Thank you so much.
Hi, so now we're going to the main part of our talk today, and something which I'm personally very excited about because I'm a big fan of the company. I took a test already. I took a test of several other companies. I've learned some interesting things from the DNA test from 23andMe, which I didn't expect to hear. So I still keep learning about my body from this company, which is very ambitious, and I really can't wait to see how they can help us in the coming years. So now we are going to be enjoying the main conversation. So please let me, without any further ado, bring on stage Thorold Barker, the chief editor of the Wall Street Journal for Europe, Middle East and Africa. And he'll be speaking to Anne Wojcicki, the founder and CEO of 23andMe. Enjoy the conversation.
Thank you, Marian and Anne. Great to meet you. Welcome.
Thank you.
So, Anne, where are you joining us from? Just give us a quick sense of where you are at the moment.
I'm actually, we just got down. I'm down in LA with my children. So
okay.
we escaped briefly to the beach.
Excellent. And how's it been? Just give us a sense to start off with. This is obviously a strange time to run a company remotely. Can you just give us a sense of, just to start off with, how it's been? You know, what have been the challenges? Have you learned any exciting things that you're going to take forward into the future? Just give us a sense of what you've been experiencing recently.
It definitely, it was a strange time, and we were relatively early at, we did sort of a trial of let's close down the office, and we did it a week before there was actually a shelter in place. And again, it was important we'd been actively engaged in that conversation about how you could work from home. And I think the main thing that we learned is that the same way everyone has different learning styles, people have different working styles. And some people are totally thriving in this environment and they love it. They love remote working. They love being virtual. It brings out a whole new side of them. And some people really don't like it. I think what I've been most surprised about is how productive overall the company can be remotely. And it sort of has forced everyone to evaluate and say, we had strong opinions about working from home, but clearly it's functional. And it's something that going forward, you can't tell people anymore that you can't be remote or that you can't work from home a few days a week. Like Zoom has absolutely made this all possible in a relatively positive way. So I've actually been really pleasantly surprised at how well it has worked. And there's certain areas like our therapeutics business, like you have to go in the lab for that, but we'll be able to open that and have shifts and, have people, special protocols. But otherwise, a lot of it, we can work relatively well from home.
And do you think there'll be long-term changes that 3 years out, 4 years out, assuming that we find some solutions to the pandemic, are there going to be long-term changes that you would embrace that will fundamentally change the way that you run the company and people work?
Absolutely. We've already committed to employees that we will not have significant back to office return to work this year. So for our number of our employees who are living in small apartments and commuting, they said, we're giving up our apartments and we're going to move somewhere else. And they can continue to do work from Colorado or Utah. So there's things like that we've had to commit to. And I think that's also part of the broader commitment that we have to just reimagine what does workspace look like. So I do envision in the future that there's suddenly a world of opportunity where a lot of employees don't have to be in the office every day. And frankly, like it's kind of exciting because Bay Area has been hard, it's hard to recruit to. Real estate is so expensive. And if you can give people a better quality of life by living somewhere else and still be able to have really interesting jobs, it's a kind of a win-win for the company and it's a win for individuals and quality of life. So I feel like the talent pool is going to dramatically open up for us.
Excellent. And obviously this is the latest radical change that's happened that you've had to deal with in your career. Can you just take us back quickly? We're here to celebrate female entrepreneurship. Just tell us a little bit about, some of the other big moments in your journey, and particularly, you were an analyst on Wall Street. What took you into this area, and give us a sense of, some of the high points and low points of that story.
Of the Wall Street days, or just getting into where I am today?
No, of the change. The Wall Street days, okay. Less interested, more interested in, why you flipped and the experience of doing so.
Yeah. I love, one of the primary pieces of advice I give people is to, seize opportunities that come your way. Like it's hard to, if you have a definitive plan in life, you're often disappointed because it's so hard to necessarily make things work. But if you can see opportunities every day, you have, chance to, have incredible adventures and take advantage of what comes. So I never planned to be on Wall Street. And I didn't know anything about it. And I ended up being there for 10 years. And the best thing that came out of it is that I got an incredible first-hand look at at the healthcare industry and how the finances work and how the entire industry works. And being on Wall Street and being able to call up any biotech CEO or healthcare CEO or hospital CEO and learn about the finances, how they function, the incentives was absolutely amazing. And I feel like what almost every single experience I had during that time period has influenced me in some way in how I run 23andMe. And it was really learning that first and foremost, like the consumer doesn't really have much of a voice in healthcare. Even though healthcare is all about us, the people, it's entirely a B2B business. And because it's a B2B business, it fundamentally encourages, I think, it doesn't necessarily represent what we want or what's in our best interest. And I think the other thing that I really learned is that healthcare is such a big industry that I think it will never change from within. And that the only way you can get healthcare to really change is a competing force that is entirely external. So part of the reason why we wanted to be, not HIPAA compliant and outside of the regulatory, like all the things that we did were totally outside of the system because we felt like the only way we were going to change is to totally be outside. And what's interesting now is, again, it wasn't premeditated this way, but I look at who runs YouTube. Like YouTube really changed the entire media industry in part because it gave power to the people. And that's part of what I see as the potential of the platform with 23andMe is that we're giving a voice for people to rise up and to actually say, like, we want to be in charge and to create a B2C business. So part of, again, what I was inspired by from Wall Street with like the HIV days and the activism that we saw. And I really look at 23andMe as this what I saw, the crowdsourcing movement, like, groups like Livestrong, Susan G. Komen, plus, the online platforms, the early days of Flickr, the ability to marry sort of this goodwill energy plus a social networking platform and realize that we have an opportunity to really give people an opportunity to learn about themselves and to rise up and to be actively involved in healthcare, prevention, and research.
So before we get into the nuts and bolts of the company, which I'd love to do, obviously, in a little bit around some of the issues around data and other things, a part of this is about female entrepreneurship. Can you just give us a sense during that journey? Obviously, women are underrepresented in Silicon Valley. How was that experience as a female entrepreneur, a fairly rare breed at your time to get the success that you've created? Were there any tips or lessons or experiences that you want to share with people?
I've been really lucky. I've been lucky to have really good people in my life that mentor and support. And one of the key things that I learned was that there's men, there's women, and there's assholes. And you want to work with the men and the women. And the flavor of assholes come in all forms.
What's the breakdown on Silicon Valley, would you say, of those three, if you were to put percentages to them?
I think that, it's hard to put percentages. I'm really quick. So for instance, like every time we do fundraising or we do a partnership, like I'm pretty quick at assessing the situation. And then if they're not going to be in the female male category, like I just move on quickly. And I think one of the main things I have learned is like choose, like if you don't try to change people, if someone like if it's the wrong fit with an investor or it's the wrong fit with a partner, just move on. And there's lots of great people out there and you're stronger. As soon as you can find those people, you'll be stronger. So, every so often I, bump into an old boys club and you're excluded from one way or the other. And I think back on my Wall Street days where, there used to be meetings in all men's clubs and obviously I couldn't attend. And so every so often I bump into that and it can be frustrating. But again, it's part of it is like, you find the network, and I'm really proud of, there's a lot of really great women dominated networks now. And I think one of the main things I try to do, and I think I learned this a lot from my sister, is that we have a responsibility to also reach out and to mentor the next generation. And so I'm very cognizant of like the people who helped bring me up. And frankly, there was great men and there was great women on both sides. And like, I'm super supportive of them. And I now have that responsibility to do it for others. So I think about it within the company and how I grow the female directors and VPs and those leaders. I want people to go on and spread it, because again, the number one thing I can do is influence others who will then go on and influence even more.
Okay. And is that changing? I mean, have you seen a big change in your career? Is there progress that is meaningful?
I think we do. Change comes slowly, but I think when I look back on when I started my career, I wasn't allowed to wear pants. Like I had to wear a skirt. So I do feel like, and I used to get lessons in how to tie scarves. So, you know, we've come a long way. I mean, look at me now wearing a scarf. So I think it's come a long way. It's hard in like I said, in details. And frankly, like this taps into, we can't have this conversation without us talking about the Black Lives Movement. And I think that's one thing I think about now is, 23andMe is we're 50-50, like it's half men, half women. We've done a pretty good job there. But I think thinking about what other groups have not had those opportunities and how I have that responsibility now also as a person in a position of leadership and with resources, like what can we do? And that's where I find like the underrepresented minorities in science and like basic science is just, the numbers are awful. And so that's why I've been really focused, like, okay, I need to work with women, but I need to also work with all women. And how is it that I'm making sure that I'm cognizant of that? And again, one thing, again, as I've thought about, unconscious bias. And again, maybe it was unconscious bias when I think back on the guys who would, set up a meeting in an all males club and I couldn't come. So are there things that we're doing that potentially, are not encouraging of all women? So those are some of the things I think that, I want to make sure that we get a diversity and representation of all women. So that has been really hot on my mind. And, again, especially finding women in science. And there's a few small foundations I've sort of discovered trolling on Twitter that I'm excited to support. And again, we need more representation of women in science.
So you raised the really important issue of Black Lives Matter. This is obviously, we had some great comments from Gary at the beginning, and such an important issue. You wrote a letter that I'd like to just quote a little bit from on June the 2nd. You said, our management team, board and employee base must have greater diversity. I'm ashamed to say I do not have a single Black employee who is at director level or above. Our product is Eurocentric, but must expand to be inclusive and equitable. We absolutely have the potential to be better. Despite our efforts, I have to honestly say that we are also part of the problem. So this is obviously something that you feel strongly about and feel that you have a lot to change on this. Can you just give a sense of, for Silicon Valley as a whole and for you, and what the sort of priorities are to make that change actually happen in a meaningful time frame?
I think the first thing that was important for me is when we wrote that letter and as this movement has come, because again, I feel like we're a company that's filled with the right intention. People really care, and yet it's not happening. And, in that YouTube did the graduation speech and Lady Gaga spoke about, again, racism as this incredibly deep forest and the roots and how it's absolutely intertwined in the fabric of our society. And I feel like there's parts of it that's true. Like we're so motivated in the right way, but figuring out how do we stop it and how do we change? So this is an example. We're looking to hire a director of design. And when I look at my agencies that are going to recruit for us, you know, I stopped and I said, is there anyone of color in those agencies? And that's part of it. Is I find that people are going to find people who are like them. And I think in neither, you know, it was a debate. Like, I don't think there are, like, they're not necessarily going to have great connections to underrepresented minorities. So then is it the right thing for us to do to use those recruiting firms because they're going to find the people that they know who are going to be most like them? So that's an example where I said, we have to reevaluate now, like, well, who are we using for recruiting? And our connections, like all of our connections, are we finding the right talent pools? And I have no doubt in all kinds of areas, we can find that talent. We're potentially just not connected in the right way. And I think there's that stat from LinkedIn that was really powerful, that 70% of people find jobs through a connection. So if I'm not connected to that community, I'm disadvantaged. I have to fix that. So that's one of the first things for us to do, is to have that connection. There's other things that I mentioned in, there's a total lack of Blacks, and especially underrepresented minorities, but especially Blacks, in basic research and in the pharmaceutical industry and the drug development industry. And I look at that and say, that's not something that I can fix just with my pipeline and hiring. That's something where my company has a responsibility to offer internships and education, and to try to like get that excitement out there to these communities, because there's a whole world clearly of untapped potential. Like, in some ways it's exciting, because I think about, there's a whole community here where we haven't had that opportunity yet to expose them to this industry that I personally think is just amazing and super exciting. And there's probably all kinds of brilliance there. So that's an opportunity that it's not a 5-year fix, that's a 20-year fix. So I look at, there's things that we can do in the short term, but there's absolutely things that we can do in the long term. So we're looking at the company in a number of different ways, from, you know, our hiring to what's our work environment, to our product, as well as to our external relationships, and making sure, are we working with groups that are also representative, and are we making those right kind of choices? Because how we spend our dollars is obviously really meaningful.
Yeah. And do you, I mean, you make this very important point around just tapping into all of the talent that is out there, and what you're currently potentially missing. Can you also give a sense of what you're missing in terms of understanding the broader population that you're selling to, that you're trying to bring into your community and sell products to? I mean, do you find that by missing that diversity, you're actually missing voices that bring a better understanding of how you bring those communities into your product as a whole?
Mm-hmm. We have always tried, again, in part, and thankfully in the early days, the people that we hired on the research team had a lot of experience and thought about diversity and understanding different populations and the sensitivities that come with research in different communities. So I'm really grateful. People like Joanna Mountain, who's, again, been at the company for a long time, who was a professor at Stanford, who spent a lot of time on population genetics, really helped us think through a lot of how the product needs to grow. Again, the sensitivities for different communities. So we do spend a fair amount of time thinking about, you know, what each community needs. And for instance, again, thinking just on the Black community, there's a lot of trust issues in research. And we spend a lot of time thinking about, how is it that we can build trust? Because it's not about just coming out on day one and saying, hey, we're going to do all these things, because there's all kinds of all kinds of experience with abuse. So we have to build trust. And the first thing that we have to do there is listen. And
Right.
again, it's not a simple solution, but like listening to people, understanding what those needs are, and making sure that we're hitting those needs. And then I have found personally, again, because 23andMe, we're entirely built as a B2C company. We're entirely built on the relationship we have with our customers. So if our customers don't trust us, I don't have a brand and I can't do the research that I do. So we intentionally set ourselves up so that we represent consumers in their best interests. So we always want to learn more from our customers about what is it that they want. And the most important thing I have learned over the 14 years is that the more transparent I am with my customers about what I do well, and frankly, also what I don't do well, and when we make mistakes, the more that they learn to trust us. And that's been really key for me. And that was also like part of the letter when we put out, was being really clear with our customers about, like, this is how we see ourselves now. This is where we stand. And part of, being a Eurocentric product today, we can absolutely do better. And now we're at that stage. Let's define what better actually means and what do those communities want.
Okay. So I'm going to, as we go on, I want to get into the company more now, which would be fabulous. I'm actually going to bring in some Slido questions as we go through, because I really want to make sure that we're reflecting what people want to hear in the audience as well. And just to your point about trust to start off with, and the importance of trust, we've got an interesting question here that is, has the Elizabeth Holmes scandal affected your business and how clients view the company? So again, coming to this point that you've, I think, been talking about. The Elizabeth Holmes, the Theranos scandal.
Theranos. What's interesting is that people come to us and say, like, oh, you're another woman in tech. It must have impacted you. And it's surprising, like, that's one area where I think about with women, like, there's a small enough community of us that it does have an impact. People always associate us together. But frankly, it's not, I think I don't think this is more a reference to her as a woman. I think it's more a reference to the industry that Theranos was in. This is an industry that is all about trust. Yeah, and I think what's interesting is that it usually comes up, people usually pose the question as like, oh, you are two women in the industry. How has that impacted you? Okay. And so even though it's like two companies, people elevate it to the question of women. So it's something that women get all the time, is like, because you're a woman, people are always like, oh, you're a woman. How does that impact you? So the reality is that the tech side, it definitely makes people question technology more. But it's part of the thing that I've always said, is that the theme of transparency that we have, we are super transparent about the science, how we do things, our publications. So Holmes was absolutely not transparent. She did not have publications. She wasn't open about how her technology worked. So I said, we're night and day different, because ask me any question and we'll answer it. I have 150 scientific publications that talk about how we do what we do. And from day one, we said we have no business without the scientific support of the academic community. So we're night and day different in that way. And in that capacity, that just changes the conversation.
And when it comes to data, obviously the foundation of your business is this data that you collect and are able to use in positive ways, and also obviously feedback to the individuals. And we'll talk about that in a second, but how much concern is there about the privacy and the use of that data? And is that shifting over time, or is that fairly constant?
What's interesting is our consent rates for research have always been very consistent. In the last decade, they have not changed much. I think that we saw last year sales on Ancestry definitely slowed. And I would attribute that, at least in part, to the concerns on privacy, Cambridge Analytica, the sense that people feel out of control. And again, I think I absolutely recognize, I think that there's, even I feel this, like there's a sense of, I don't know where all my data is, and it's not terribly transparent. So 23andMe has taken the approach. We want to have a brand about the fact that, about research. And we want to make it really clear for people when they have opted into research and when they have not opted into research, and make it easy to stay in or to opt out. So transparency is one of the key elements for us for having trust and helping people know, what we're doing with data and giving them choice. At any time, you can opt out. So I definitely think that there's an overall concern about privacy and where everything is going. And there's a great article a while back about, all the data and where your data is in the world. And do you recognize, it was about location. So like I said, I think there's a lot of concern. Even before this call, I got some kind of alert, had hacked into an account and using my data in some way. And I just, I get this once a week. So I definitely have concerns about, I'm very cognizant. We have to do everything we can to protect the privacy for our customers. But most importantly, I find for people, it's about transparency. How are you using my information? And do I actually want my information used in that way?
And what percentage do opt in for that use of it for medical purposes?
Over 80%.
Over 80%. So tell us how you do use it. You have relationships. You have a big relationship with Glaxo, for example. Can you talk about how you share that data, how you use that data to further the needs of patients and, frankly, your users?
Mm-hmm. Mm-hmm. The most important thing that we try to do is find some kind of benefit from the human genome that will come down to our customers. So I think about really two areas where we're using it now. One, we look at all the data and we try to make discoveries. And some of those discoveries come back into reports for our customers. So for example, we have a type 2 diabetes report, and all of that information came from our database. So we see it as a circle. Our customers join, they give us information about themselves, we can do analysis, and then that analysis goes back to our customers. So if you look at our blog, if you look at even things like the COVID-19 research that we did, and the O blood type that looks like it's somewhat protective, all of that comes from our customers. We do the analysis and we want it to go back to our customers. And our customers, like one thing that we have said is like one of our taglines is change what you can, manage what you can. So I think about, again, in the world of research, there's all these things we can do where people can potentially change their environment. Like type 2 diabetes is a good example there. We tell you a risk factor. Are there things about your environment you can change? But if you have a disease and you can't change anything about it, can we potentially help you come up with a treatment or better information about that disease to manage it? So that's an example where we do drug discovery. And in the early days, we had a number of partnerships, but we found that the best way for us to move these discoveries forward was to do an all-in-one inclusive part one group where we could really look through the entire data set we have, make a number of discoveries, and try to get into the clinic as quickly as possible. So in 2018, we did do a big deal with GSK. It's been great because they understand the potential of genetics so much. They understand the importance of having novel discoveries and, not Me Too drugs, but having really innovative programs. And they have all the resources to move this through. So I'm really excited because, again, our customers have come and said, if they're not sick, they would love to better understand how they can be healthy. But people who are sick with a disease, the number one thing they want is to get better. And so that's where we're working on that.
You mentioned the COVID trial or the COVID sort of data that you got about O blood type, which is very interesting. Are there any other areas or any particular treatments that you are particularly excited about right now that you can share?
Well, we have the pipeline. The thing that's most interesting with our programs is that they're very diverse. So most companies come and say, we are a psoriasis company, and therefore everything that they do is on psoriasis. And what we do is we start out just with data. And we say, where is it most likely that we could be successful in, with our data? And that's where we have everything from cancer to heart disease to skin conditions, really interesting novel insights that we're moving forward. Then you have the whole world of drug discovery. Then you make an antibody or you make a small molecule. We're running, some of the preclinical programs, and then, and we'll hope to be in humans this year.
Okay. So I'm going to take it back, an area I wanted to get into, but I've got a more eloquent even question here about it, which is, how have you handled the topic of ethics, especially with customers learning of conditions they may be predisposed to and they can't control? And I guess, just to add to that, this question of, do you literally receive an email saying you have a certain gene that massively increases your risk of disease X? And, is there any sort of counseling that goes with that or anything, or do you just literally, boom, suddenly you're hit with this? Can you just talk through that?
Mm-hmm. We never put anything in email. So This is all about, one of the key tenets of 23andMe is giving customers choice. So the same way that you can choose to have children, or you could choose to buy a gun, or you could choose to, go on a diet, or you could choose to, you can choose to go on vacation. You have choice, you have agency over your life. And one thing that we found really important is our customers, we want to give them agency and choice. So I find it, to me, it's one of the most insulting aspects of healthcare that I have to ask permission when I want to learn things about myself. I find paternalism is remarkable. And as a slightly irrationally independent individual, it drives me crazy. And so I feel like if I'm in charge of my body, why do I have to ask permission for some of these things? So 23andMe was set up with this idea that we will give you choice. And it's not mandated that anyone does 23andMe. And it's not mandated that you look at all of the reports that we give you, but we give you choice. And for our highly sensitive reports, which we classify as BRCA for breast cancer, ApoE for Alzheimer's, LRRK2 for Parkinson's, the colorectal cancer report, I'm trying to think of any others. But for all reports, we will have an additional consent. So you have to go through, we'll have information about what you're likely to learn, what does it mean, and we did specifically to say that we can give you all this information on your own, and you do not need to have a genetic counselor or physician. Because one thing, even in my own personal experiences, I have found that I oftentimes learn better on the web than I do necessarily through a one-to-one interaction with my doctor or my genetic counselor. And the reality is, when we think about where healthcare is going, if you want to give people better healthcare, it cannot be dependent upon a one-to-one interaction with an individual. You have to find ways to scale. And so what 23andMe is particularly trying to do is say, are there ways to scale genetic access that does not become reliant upon a physician or a genetic counselor? And so we give people this information. We have a tutorial. They log in. We've done all of this research now for the FDA and for others about how our customers are reacting. And overwhelmingly, we find people can get this information at home and absorb it, and they make the right decisions going forward. So if you find out that you are a carrier for BRCA mutation for breast cancer, you follow up with your physician. And we provide resources, links. There is a link to genetic counseling if you want it. But we find most people, the way you're getting information now is oftentimes online. And so you read what were other people's experiences, what are other resources. So we want to do everything we can to make sure we provide that information. But first and foremost, we're giving people choice of having that information to begin with.
So what's I think that makes a lot of sense. I mean, what's lockdown meant in terms of accelerating this process? In that, you know, you haven't been able to just go to the doctor in the normal way. You know, there's been a much more digital interaction that's occurred, and in some cases, people have got used to doing that rather than sitting in a waiting room, going and seeing somebody, talking about it, etc. I mean, do you feel this has been a moment which has really accelerated the way people access healthcare and think about healthcare?
To me, this is the silver lining in COVID and this pandemic, is that everyone has talked about the potential of digital care, and COVID-19 is forcing it to happen. And I think there is, similar to how we talked about working from home, the world, in my mind, I don't believe the world will go back to medicine the way it was. I think people have seen the light. Digital care absolutely makes sense. I can call my doctor. I can see them remotely. I can send a picture of a mole and get that analyzed. I can do physical therapy through my phone. I can do yoga through my phone. I can do all kinds of consults through the phone. I use a device actually for my kids called TytoCare, where I can look in their ear and I can see if they have an ear infection, and that goes directly to my doctor. I think there's amazing ways to leverage technology so that you can stay at home for your care. And I think the world will not go back. And, you know, one of the things that I think that I've been also inspired by in this time period is people suddenly don't want to get sick because you don't have a lot of choices. So even the thoughts around prevention, mental care, you know, ways that you can exercise better at home, thinking about how you're eating, like everything's changing. And for a community like this that's listening, like this is the opportunity to seize the change. Like it's been forced upon all of us. So what are some of those opportunities? And I see, you know, even the future of COVID-19 testing. Do you really want to go into a hospital or a doctor? No, you want to do it at home. So at-home testing is definitely the way things are going.
That's interesting. So how do you, I mean, there's been, say recently, you know, I think we at the Journal wrote about the Ascension relationship with Google, Project Nightingale, and there are still sort of concerns about some of these data sharing of health information with tech companies as tech companies try to go into this industry and change it. Again, is that something that is going to remain a really tough sort of taboo to end, or do you think we're getting to the point where people will understand the benefits and really be much more willing to do this? What's your sense of that debate?
I find it totally offensive how difficult it is to get medical records, and I also just want to echo the outrage. Yeah. My medical records from the various doctors I go to, it's impossible. Right. It's so hard. And I also find the consent form of hospitals. Have you ever read them? Like they're awful.
I've been faced with a lot over the years. Yeah.
They're awful. And then there's it's part of it where they say they can go and do whatever they want. Like, I have no idea when I go and I get care at Stanford or other places, what did they do with my medical record? I have no idea. And I think that goes to my point about transparency. I equally am offended by the fact that I lack control. And so again, part of what I think about with 23andMe is give people that control. I'm very independent and I like to be in charge of things. So I want to know what's going on with my data as well. So 23andMe is very much about make sure people are aware and that they're in control. In my own healthcare world, I think that there absolutely needs to be some kind of reform. And almost like how GDPR has required a level of transparency, I would love to get a GDPR report that reflects from my medical groups. What did they do with all my information? Because that's one thing that's interesting. There's all these data exchanges. There's the whole B2B world. Your data is going all over the place. And we don't necessarily know. No. So there should be a transparency report. So I absolutely agree. I think there's incredible potential for what could happen with all this healthcare information and big data. There's amazing potential, but you have to give people a voice and some kind of transparency and knowledge in how it's going. And I frankly think everyone would be really excited because everyone hates the healthcare system. So there's a huge upside. Like, people would love to just better know or have some kind of data. We're trained now. We have data in all kinds of other areas. Like, you're learning how to play tennis and, these different steps. This is the trajectory you're on. You just don't have that in health, anything like that. So that's where I think there's a huge potential of using this data to better understand your health and your likelihood of staying healthier or having conditions.
And do you think regulators agree with you?
To be honest, I think that I don't think regulators, again, I see the issues right now with GDPR and what's coming up in Cambridge Analytica. And frankly, I think that the tech world, healthcare is somehow excluded. People don't recognize yet what's happening with your healthcare data. I think there has yet to be an awakening. And I'm hoping one day that there is, and that people recognize there's all kinds of, one of the common things that healthcare companies complain about, and you saw this a little bit with Epic, is that there's danger of letting you have access to your medical information. That it's much safer if all the companies trade your information without you knowing, but that there's a danger of you having it. And I think that's just crazy.
Yeah.
So I think that there has to still be an awakening.
So I'm going to ask you one more question, and then I'm going to go back to Slido for the last 15 minutes. But just, can you talk a little bit about, in January, you had to lay off 100 people. Can you talk a little bit about where the company sits from a growth perspective now in terms of bringing in new customers and sort of what the opportunity and the challenges are for you?
Mm-hmm. We had, again, layoffs are always awful. And it was sad because we hire amazing people. And in 2017, we saw this explosion of growth. And I said, a lot of our OKRs, the objectives and key results to the company, were about the importance of growing and scaling the database, scaling the company, scaling everything. I said, originally what was critical for the company was making sure we had, the right science, the right privacy, the right, infrastructure. But we hit a point where I said, the most important thing for the company now is to scale. And we scaled. And then the market, we were absolutely caught off guard and surprised that the market contracted. And we weren't sure if that was a short-term blip or if that was going to be sustained, but it's definitely leveled off. But the market contracted, and we had hired quite a bit for anticipating growth. Right. So it was unfortunate, but again, the most important thing I have to do is I look at all my employees as individuals, but then I also have to look at the company overall as an individual. And, we were close with employees, whether they're in the company or out of the company. And it's always important for us to treat people well when they leave. So,
is growth coming back?
Is what?
Is growth coming back?
Growth, I have to say, I have been really happy. We definitely took a dive in March briefly, and we took the Sequoia Black Swan letter to heart and really planned for the worst. But I have been really surprised and happy with how much people are engaged in 23andMe and buying. And we saw this over Mother's Day. We see this now over Father's Day, that sales have really returned. And, it's, again, I'm optimistic too, because I think the next wave of growth is going to be more about health. And people understand ancestry, and there's always that engagement in identity. And frankly, the ancestry discussions come front and center with the whole conversation about race. And it's one thing I've said a lot is that we didn't plan to get into the conversation about race, but we're now front and center because we can see the genetics of ancestry. So, but I think of the next phase for us is really about helping people use their genetic information to stay healthier. And that's why I see the silver lining with what's going on now, that we have an opportunity to let people know what their risks are and to help make them healthier.
Okay. I'm going to go back to some questions from the audience, if that's all right. There you have it. We have the animation. Thank you. So just going back to some of the questions from Slido. There was a nice one here. When you started off in the bootstrapping days, what was the area you lacked the most expertise in? And what was and just to add to that, what would be your advice in countering that?
Oh, it was so obvious. The area we lacked expertise was operations. This is always a funny story for entrepreneurs. We launched and we were selling, 20 to 50 kits a day. And then we had this idea of dropping the price down to $99 for DNA Day. And, that was when, it was like I think maybe the first or second time we had done DNA Day. And suddenly it went viral. My head of engineering at the time called me at 7 in the morning and he said, Anne, we set a limit of 1,000 kits and we blew through the 1,000 kits already. And in my naivete, I said, that's amazing. We should just let it go. Let's just see how much we can sell in a day. And by 5 o'clock, we had sold 17,000 kits. And it suddenly occurred to me, like, holy cow, do I even have the inventory of chips? Like, what do we do? And so I called Illumina and the CEO and he said, we can make you some more. Let's we can max out at, I think it was like 19,000. So we sold up to the max. And then it became the question of well, how do you, we have to ship out all these kits. And we used to ship stuff out of our office. So we then had to shut down the whole company. And I had all my engineers, all my scientists, we had an assembly line, and we had to get these kits out the door. And then I learned that a lab that's used to processing 20 to 50 kits a day can't suddenly absorb 17,000 on one day. So it was one of those things, I didn't quite think about the downstream effects of we actually have this product, it impacts all of our suppliers, it impacts all of our lab people, hiring. So operations, and again, a lot of this came from me as the CEO. I was naive about, again, all those various impacts. But that was one area where I think we, in volume was low. We hadn't really hired that expertise. But again, we learned a lot through that experience. And one of the things that's so fun is, as a startup, is you just make mistakes and then you learn from it, and that's how you get better. And so now I got an amazing operations team.
Fantastic. That's fascinating. How do you convince, increase male investors to invest in femtech? Numbers show that primarily female VCs invest.
Like I said, I guess that's interesting. We had, on our last financing round, we had an all-woman pitch team, essentially. It was me, my head of business development, my head of legal, and we were all women. And what was interesting is, and my banker was a woman, we pretty much met with only men. And it was definitely interesting that it was, we were, hoping to meet other, women partners. I do think it's a question inspired by the number of men, again, they're looking for the right idea, and they want to encourage and back diversity, and they also want to back a great idea. So I have been really lucky with all my investors that they see the 23andMe and what we're doing and growing it into a real force. But they also love that what we stand for is a company that is about, equality and opportunity for everyone. So again, kind of when I went to the men, women, assholes, like you find the people who really want to support a world of diversity. So one of the things I think about now too is making sure that I don't just have all male investors. Because again, that's part of what I think about when I think about the pillars of how we're going to change. Do I have, who's benefiting from our growth? And do I make sure that I have representation within my investors? So that is one thing I am specifically thinking about now as well.
Interesting, thank you. So I'm going to actually sort of combine two questions, sort of. So the first one is, how do you expect 23andMe's product performance to improve over time, e.g. faster tests, more reports, greater accuracy, and are there changes coming? But also, just to add to that, there's another question, which is what's the long-term vision for the company and what's it going to look like in 5 years? So they're slightly different animals, but if you could just address both of those, that'd be great.
We're spending a lot of time on what we call polygenic risk scores. And polygenic risk scores are where you look at hundreds or thousands of mutations of small effect size and you put them into a score. So for instance, our type 2 diabetes report is one of the first examples of that. And what's great is that we can, because we have such a large community and our customers have consented for research and taken our surveys, we have the ability to make a huge number of discoveries. So, and you can do that on common diseases, whereas BRCA, breast cancer report, is incredibly impactful, but it's impactful to a very small number of people. And so the type 2 diabetes report is impactful to everyone gets a score. So more and more we're looking at ways that we can leverage our size to give meaningful information back to our customers. And I think about what defines success for me in 5-10 years is, did I actually make my customers healthier? So when we surveyed our customers a couple of years ago, we found that almost 70% of them were making lifestyle changes. They're looking to change their food, they're looking to change their exercise, they're talking to a doctor, they're looking to make some kind of change. So how is it that 23andMe can better support that change? And frankly, that's where digital health becomes really interesting. And what are those opportunities to actually get people to be healthier and drive that change? So I think a lot about that from the consumer experience, and more, how does 23andMe help people get the care they want, the prevention, the engagement with the medical world. We have a huge number of people, and there's not really a singular platform for digital healthcare out there. So we think about that. How do we help plug in? Mm-hmm.
And do you think that it's a benefit for you, going back to this question of 5 years out, to be an independent company or part of a bigger healthcare company that can pull data from lots of different places and triangulate it?
We definitely want to be independent. I think the number one thing that is missing in healthcare is the B2C business. Like, we represent consumer interests. And frankly, we represent transparency and research. Like, our brand is about our customers overwhelmingly trust us. And I think I would be so cautious of us, again, as we do partnerships, everything we think about is about how are we making sure that we keep that trust with our customer. And again, there's a little bit of a fallacy that medical records are great. Because medical records, like, if you've ever read your medical record, like, tell me if that's actually reflective of you and who you are, how you live your life, your health. Because oftentimes it's missing pieces. So part of what we find that's great is self-reported data. If I ask you to fill out a survey, it's frankly not that different than you going to the doctor and writing on a piece of paper the intake form and then seeing the doctor. So we have found that that relationship we have for self-reported data is great. And I think that we're really unusual in that we're a business directly related to our customers. And I'm very, very protective of how our customers are going to benefit and how they're treated. And they're our number one priority, always.
So if I give you my genetic data, what is the value of, for example, me then saying to my doctor, you can share my records and any new symptoms and stuff can get fed in? I mean, is that a powerful combination that allows me to see how, things I'm predisposed to are progressing, or symptoms that are kicking in that I should worry about? I mean, is that intersection important?
It is. I think that we've always, really tried to understand what's the best way for us to integrate with the medical world. So there's absolutely things that we would love to pull from your medical record. And the stuff that we would want to pull from your medical record is the stuff that's hard for you to remember. For example, your blood values or your specific medication dosing. That information is harder to pull. So we would love to pull that because it gives a more complete picture about you. So when I think about, we want to have a two-way exchange with the medical world. If you are high risk for, breast cancer and you have the BRCA mutation, your doctor should know that. And finding a way that we can make sure that information is in your medical record is really important. But frankly, a lot of doctors are not deeply involved in the process of keeping you healthier. So your type 2 diabetes risk is potentially an important data point to put in the medical record, but the long-term engagement on a daily basis is not necessarily part of the medical experience. It's part of all of these consumer app experiences. So it's an important data point, I think, for doctors then to understand and say, hey, we might want to test you. You might want to be monitored in this area. But you might probably go to the doctor once a year. If you go to the doctor once a year, you have those 365 days to manage your health that you are responsible for. And that's where we want to own that experience of how do we actually help keep you healthier in between those doctor's visits. And we are always thinking about ways to integrate the data and to plug it in to the medical system. It's been remarkably challenging.
Okay. I'm going to go to one last question in a minute because I think we're probably running out of time. But just, is that how your customers perceive you? I mean, do they see you as that sort of ongoing sort of healthcare resource? Is that, or do they see you as a sort of, you buy your test and then you're done? How do people think about you as a company?
People definitely, people are engaged with 23andMe. We see our customers who purchased 10 years ago are coming back on a regular basis. So the ongoing reports, the ancestry information, all of that is really engaging for people and gets people coming back. I think that when I've surveyed my customer, the number one thing that they look for is says, like, I got this information, I want to do more. Like, what are those various steps? So we see that with Alzheimer's risk. You can be genetically high risk for Alzheimer's. What can you do next? And what's exciting, we've piloted a lot with Parkinson's. And part of what we see is people can be genetically high risk. Well, now can we actually engage them with academic partners in exercise research studies that help prevent, or nutrition studies that would help prevent. So there's a whole world of prevention. I've always thought of 23andMe as like, we have our consumer business, and then off that, I potentially have a whole prevention world, and then I have a therapeutics world. So how do I really effectively help people prevent disease? And then if they have a disease, how do I really effectively help them treat it?
Right. Fascinating. So I think we're on time, but I'm being told I can do 2 more questions. So bear with me.
Okay.
There's a lot of questions. It's sad we won't be able to get to all of them. Okay. I mean, I think in the spirit of what we're talking about, let's go with these 2, which are broad, but I think important. So what is the best piece of advice you've been given? And again, thinking about the audience as probably people who are, in many cases, aspiring entrepreneurs.
The The best piece of advice, it was a couple things. It's what I said in the beginning. I think I've always been good at seizing opportunities and, seeing, again, something comes your way. Like I got the Wall Street job. I wasn't even applying for jobs. It sort of showed up. Like take an opportunity, especially if you push yourself when you're going to learn. So one piece of advice on that theme was always push yourself to keep learning. Like when you're uncomfortable, it's good. Like push yourself. If you're cozy in a job and it's great and it's easy, quit and do something else or ask for a different type of role. Like keep learning and keep pushing yourself. So the second thing, so there's really two pieces of advice. One is keep learning. And I encourage actually all my employees, like keep learning, like demand of me that you're learning more and that you have opportunities. The second thing, and I remember I used to complain about healthcare all the time. And when I worked on Wall Street and I would complain, I was like, it's kind of what everyone does. It's awful. We can't stand the system. It doesn't reflect like, like they hate the system. Like I hate going into the doctor. And I remember Larry Page saying to me at one point, in his, typical kind of terse style, he's like, Anne, you're either part of the problem or you're part of the solution. And that really stuck with me where I felt like I was here complaining. Like I saw the problem, but if you just sit there and you complain all day, you're not part of the solution. Anyone can highlight the problems. It's kind of like what we have right now with Black Lives Matter. We can all highlight the problem, but we got to be part of the solution in some way. And so for me, starting 23andMe was like, okay, I have an idea now that could potentially help make some aspects of healthcare better. So those two aspects for me is like, one, keep pushing yourself to keep learning and be uncomfortable. Take things, don't be afraid to quit. Like push yourself. And then second is when you see a problem, just complaining about the problem, like either you're part of the problem or you're part of the solution.
So just to finish in a sort of similar vein, but just can you give just an anecdote of the biggest challenge you've faced and how you solved it, just to kind of give people a sense of the journey of being an entrepreneur? You talked about the operational issue you had when you had too many people ordering your kits. Are there any sort of dark moments that you got through that you can kind of share that experience and what got you through it?
I think the one that gets highlighted the most was with the FDA. And, the reality is with the FDA, when we got that letter, we didn't realize, again, it's a little bit like the operations issue. I didn't realize how bad it was at the time. And it was very public. I think one of my favorite articles was 23 and Stupid. And there wasn't an easy solution. And I thought it was an example of, even though, I could argue, I thought I was right. Again, it wasn't, I do this class at Stanford every year where they ask the question, like, was it Silicon Valley arrogance or just incompetencies? And most people vote it was Silicon Valley arrogance. And I say, no, it wasn't, it was actually incompetencies. We tried, like we had been engaged with the DA, we had conversations, and we had just failed at the right way of communicating. It's very similar to the operations experience. Like I didn't have the right expertise in the building. And, one thing that when we hired the regulatory team, we hired Kathy Hibbs, who is a very experienced regulator who's been amazing. And I remember she said, when the FDA asks you to do a study on 20 samples, you don't argue with them about all the statistical reasons why you only need 17 samples. You just do the 20 samples. And it was part of like one of the main things I learned, which frankly was slightly hard for me. I learned obedience. Like I come from a very academic family where we like to debate and you like to argue. And frankly, there's a time for that. And then there's a time for you just follow the rules, and recognize also, like, when I've really grown this appreciation for the FDA, they see a bigger picture than all of us. And so getting some of that guidance and getting that input, whether you always agree or not, they are ultimately, they're the regulatory body. So, that was a challenging time. And then it was also challenging. I was getting divorced. I had 2 small children. There was a level of insanity, and keeping it together. And in some ways, that's an example of when you, the way you plot forward is it's a week at a time. Like, this is what we're going to do this week, and then the next month, and breaking down a goal into bite-sized chunks, because it was like 2012, 2013. It was crazy. So those are definitely some of the hardest times I think that the company has had, and it forced us to really pivot. Getting companies that can change behavior and culture so much, because going from an unregulated environment to a regulated environment is quite a cultural change. But like I said, one of the best things we did when, we hired the right leadership, we helped sell the company onto the vision of where it's going and what those benefits were going to be. And, by being a mission-driven company, people bought into the mission, and I'm really grateful. The company, people left. We didn't have high turnover, but it was definitely a challenge.
Good. Well, Anne, thank you so much. Fascinating to talk to you. Sorry we've run over to the audience, but I just had to ask those last few questions. Thank you very much indeed. Sorry we can't have a round of applause, but thank you.
Oh, thank you so much. It was great. Thank you.
Good fun. Thank you.
I don't know about you, but now I have a entrepreneur, not just a female entrepreneur, a favorite entrepreneur. Anne is amazing, and I'm so happy she joined us. Now, if you think this is over, it's not. We are halfway there. What we will do now is we'll do virtual business networking. You can join us if you want to. And let me bring on stage our director, Peter Savik, who will tell us what's going to happen now. Peter?
Thank you. Hey, hi, my name is Peter. I'm a co-director of Startup Grind London. I would like to say a huge thank you to all the speakers for their amazing talks, and to all of you who tuned in, really. But we could not do this without our partners. So massive thanks to Google for Startups, to Silicon Valley Bank, to Louis Silkin, Hardsoft, WeWork Labs, Index Code, Supreme Factory, and XLab Realtime, who actually helped us deliver this virtual event. And we believe that this might just be the future of how we're gonna be running live events. So I hope you enjoyed the experience and the talks. And now for the most exciting part of the event, we're gonna be going to virtual networking at our friend's platform, Remo. I believe we can show the links just here. And I hope to see you soon there in a minute. And thank you all really for coming. Bye.